Traumatic and iatrogenic sciatic nerve injury in 38 dogs and 10 cats, clinical and electrodiagnostic findings. Introduction. The article explores the clinical and electrodiagnostic outcomes of sciatic nerve injuries (SNI) in 38 dogs and 10 cats. The sciatic nerve, which is responsible for motor and sensory function in the hind limb, is vulnerable to both traumatic injuries, e.g., pelvic and femoral fractures, crush injuries, and iatrogenic injuries, e.g., surgical complications. Injections. The severity of SNI can range from neuropraxia, a transient block with spontaneous recovery, to neurotmesis, where both axonal and connective tissue structures are severed, leading to poor prognosis. The study's primary aim is to describe the causes and clinical findings of SNI, and to evaluate the predictive value of neurological examinations and electrodiagnostic tests, EDX, in determining the likelihood of recovery. In addition, the quality of life call of the animals was assessed based on owner perception, which is a critical component in evaluating long-term outcomes. Materials and methods. Animals. A cohort of 38 dogs and 10 cats with SNI was retrospectively evaluated, focusing on those who had undergone clinical and electrodiagnostic assessments and had a follow-up period of at least 12 months. Exclusion criteria involved cases where neoplasia or vascular disease contributed to the nerve dysfunction. Sample and clinical evaluation. Detailed neurological examinations were performed on all patients. This involved evaluating motor function, such as the ability to extend and flex the stifle and hock tarsus, and assessing spinal reflexes and proprioception. Awareness of limb position. Sensory function was tested through nociception in the autonomous zones of the tibial and peroneal nerves, as well as the presence of a root signature, indicating pain or discomfort when the limb is manipulated. Electrodiagnostic studies (EDX). Electrodiagnostic tests were performed after at least 7 days from the onset of clinical signs. EDX tests included electromyography. EMG measures electrical activity in muscles. Normal EMG recordings show minimal activity, while abnormal EMG can reveal spontaneous pathological activity (SPA), such as fibrillation potentials and positive sharp waves. These findings indicate denervation due to axonal damage. Motor nerve conduction studies (MNCs). Involve stimulating the sciatic tibial and sciatic peroneal nerves and recording the resultant compound muscle action potentials (CMAPs). CMAP measures the collective response of motor nerve fibers and is an essential indicator of nerve integrity. Motor nerve conduction velocity (MNCV) was calculated to assess nerve function. F-waves and sensory nerve conduction studies (SNCS). These were performed in some patients to assess deeper aspects of motor and sensory nerve function. Core dorsum potentials (CDP) and motor evoked potentials (MEP) were tested in select cases to further evaluate the functional integrity of the nerves. Outcome assessment. Outcomes were classified as either positive, partial or full recovery of motor function, or negative, leading to limb amputation, arthrodesis, or euthanasia. The quality of life call for each animal was evaluated via a questionnaire completed by the owners, focusing on the overall health of the animal post-injury. Statistical analysis. Statistical methods, such as receiver operating characteristic (ROC) curve analysis, were used to evaluate the predictive value of various clinical and EDX parameters, particularly CMAP amplitudes, in determining the outcome. Results. Sample population and clinical evaluation. The study included 38 dogs, 53% males, 47% females, and 10 cats, 70% females, 30% males. Trauma and surgical complications were the most common causes of SNI, accounting for 33% and 42% of cases, respectively. Notably, wild boar attacks were responsible for 24% of the injuries in dogs, highlighting the unique risk factors associated with hunting environments. Clinical evaluations revealed that the ability to extend and flex the stifle and hock was significantly associated with a positive outcome in dogs. The mean time from the onset of clinical signs to electrodiagnostic evaluation was 67 days in dogs and 65 days in cats. Importantly, tibial nerve CMAP amplitudes were predictive of a favorable prognosis, with a cutoff amplitude of 1.45 MV being indicative of recovery. Sensitivity and specificity of this measure were 58% and 100%, respectively. Electrodiagnostic findings. EMG results. All patients demonstrated spot-on EMG, with fibrillation potentials and positive sharp waves indicating denervation. These findings suggest that axonotmesis or neurotmesis was the most common pathology. MNCs and CMAP. MNCs revealed that proximal tibial nerve stimulation produced CMAPs with a median amplitude of 1.2 MV in dogs and 2.1 MV in cats. In some patients, conduction block and pathological temporal dispersion were noted, indicating severe nerve damage. SNCS and F-wave results. These tests further confirmed sensory and motor deficits in affected patients. CDP and MEP. Only a small subset of patients underwent these advanced tests, which were useful for evaluating spinal cord function and nerve regeneration in severe cases. Outcome. The outcomes were positive in 72% of dogs and 90% of cats. Negative outcomes led to limb amputation in 8 dogs and 1 cat, with 1 dog being euthanized. The tibial nerve CMAP amplitude was the strongest predictor of outcome, with higher amplitudes correlating with a better prognosis. Cats with SPA grade 3+ on EMG had a worse prognosis, indicating severe nerve damage in these cases. Quality of life. Most owners rated their pets' quality of life as either good or excellent, even in cases where limb function was not fully restored. Interestingly, the study found no significant correlation between the clinical outcome and the perceived quality of life of the pet or the owner. Discussion. The findings suggest that the clinical motor function of the hind limbs, particularly tarsal joint flexion and extension, is a strong predictor of recovery in dogs with SNE. The absence of nociception, pain sensation, in the tibial or peroneal nerves did not correlate with a negative outcome, which contrasts with previous studies of spinal cord injuries. This distinction highlights the ability of peripheral nerves to regenerate even after severe injuries, such as axonotmesis. In terms of EDX findings, the presence of SPA on EMG was indicative of axonal injury, and the CMAP amplitude during proximal tibial nerve stimulation was highly predictive of the outcome. A CMAP amplitude cutoff of 1.45 MV served as an important threshold, allowing clinicians to differentiate between dogs that were likely to recover and those that would require amputation or other salvage procedures. The study also underscores the need for timely reassessment in dogs with CMAP amplitudes below 1.45 MV, as these animals may benefit from early physiotherapy or the use of orthotics to prevent muscle atrophy and cutaneous ulcers caused by limb dragging. Interestingly, in cats, the presence of SPA in the semidendinosus and quadriceps muscles was associated with a poor outcome, likely due to the involvement of multiple nerves, including the femoral nerve. This highlights the importance of proximal lesion localization in predicting recovery in cats with SNE. Conclusion. This study provides valuable insights into the clinical and electrodiagnostic features of sciatic nerve injury in dogs and cats. Neurological assessments, combined with EDX, play a crucial role in predicting long-term outcomes. The identification of a CMAP cutoff at 1.45 MV may assist veterinarians in making informed decisions regarding the management and treatment of these patients, particularly in determining whether to pursue surgical intervention, physiotherapy, or amputation. The positive perception of quality of life reported by most owners, even in cases requiring limb amputation, underscores the resilience of these animals and the importance of multidisciplinary care in achieving favorable outcomes. Future studies should focus on refining prognostic indicators and exploring the role of advanced imaging and regenerative therapies in enhancing recovery from SNE.